Hi, my name is Dr. Shannon White with Chiropractic Emotion and Holistic Health, and I've been asked by quite a few people to talk a little bit about the Epstein-Barr virus, better known as EBV. It is the human herpes virus number 4. What a lot of people don't realize, it's not rare. Over 90% of us carry the virus in us already. It is most known for causing mono, and it spreads through saliva and body fluids. What people don't realize is there is thresholds when it comes to viruses. So what we call here is subclinical, where we have the virus but we don't have any symptoms. When the levels rise and get higher and higher, it's full blown and we have mono. The problem is there's this gray area in between that a lot of the medical community does not recognize. And in that gray area, you get diagnoses like chronic fatigue syndrome, fibromyalgia. It causes a lot of migraines and autoimmune and Hashimoto type problems. And so a lot of people will go to their doctor and get a blood test for Epstein-Barr virus, and it might show a past infection. The problem with that is, if you think about it, when somebody gets a cold sore, which is also another herpes virus, cold sores come and go. When the body gets stressed, you break out in a cold sore, and it's because your immune system is lowered and the virus levels has risen, and then you get the cold sore. So Epstein-Barr does the exact same thing. Sometimes we get stressed emotionally, physically, mentally, whatever it may be. I've seen people in car accidents, it just stresses their bodies. These viruses in us will get a foothold and start to increase their numbers, and that's when our health problems start. Epstein-Barr affects memory B cells, which can actually initiate autoimmune diseases. So anybody with an autoimmune disease should also be looking at the Epstein-Barr virus. When our immune systems do lower, Epstein-Barr likes to take up residency in our organs, and its favorite place to live is in the thyroid. A study, was in 2015, found that Epstein-Barr was in the thyroid cells of 80% of people who had Hashimoto's and 62.5% of people with Graves' disease. So that tells us there's a big link between Epstein-Barr virus and Hashimoto's. The other statistic is that 1 in 8 women will develop thyroid issues throughout their life. Women tend to be more susceptible to it. I'm not 100% why, but we tend to be. And so, and partly it's probably because women get checked for more of those things than and do blood work more than men do. So Epstein-Barr virus is playing a big role in our thyroid. A reactivation of Epstein-Barr can last months, sometimes years, in a more mild form than mono, but again, not give you full-blown mono, and it can come and go. And so a lot of disease processes, we think we have them and they go away, and so when they rise and fall, we don't connect the dots always with it. The reactivation, again, happens during prolonged periods of stress to the body. Some of the most common symptoms are fatigue, muscle joint pain, swollen lymph nodes. So a lot of times you'll notice some of those people that always say, I always feel swollen, or sometimes you have a hard time swallowing. And it's because the lymph nodes right here will swell up and actually put a little pressure on the esophagus as well. You'll have flu-like symptoms, malaise, even depression can come from this. Anybody that has been diagnosed with chronic fatigue, fibromyalgia, MS, and even Hodgkin's lymphoma need to be looking at Epstein-Barr. There's tons of research showing that Epstein-Barr is found in all of those patients as well. And so truly look at the body and the health of the body when you have some of these issues and you're trying to correct them or reverse them. You really got to look at the Epstein-Barr virus. So I hope this helps you guys get a little more information on the truth about Epstein-Barr virus and how it affects the body. Have a great day.